Hey everyone, welcome to the Pregnancy After 40 podcast. I am your host, Michelle Johnson, and today we have Dr. Randi. Dr. Randi has been voted the best prenatal chiropractor by New York Magazine, so I'm really excited to have her on here. She specializes in prenatal chiropractic care as well as pediatric chiropractic care, so really excited to get into that topic and just letting you kind of know what the importance of chiropractic care is and why you do it before getting pregnant, during pregnancy, and postpartum. So, Dr. Randi, thank you for joining us today.
Thank you for having me. I'm excited to be here.
Yeah, so let's just start from the beginning. Just tell us a little bit about your personal story, how you became involved in, or how you became a chiropractic or a doctor in chiropractic, and how you came to specialize in pregnant women and children.
Okay. So a lot of my colleagues have these fantastic stories where they, had an injury or had an illness when they were little and they went to the chiropractor and they fixed them and they knew from the time they were like 6 years old they were going to be a chiropractor. So I don't have that story, but I have my own story, which is that I went to college with no major. And, my counselor said, you really need to find a major. And my mom and dad said, you really need to find a major. So I ended up pledging a sorority first semester freshman year at my college in upstate New York. And I met a senior who was going to become a chiropractor. And she kind of took me under her wing and she befriended me and she took care of me and she kind of watched out for me while I was pledging. And we just kind of bonded. And I was very fascinated by this chiropractic thing she was doing. You know, she was going to go to grad school for a chiropractic. And I came home from school December break and my mom said, all right, it's time. I'm dropping you off at the local library and you need to figure out what you're going to do with your life and get settled with a major second semester. So I went to the library. She told me about a book called the Occupational Handbook. And I sat there for about 3 hours in the library. And I went through all the different careers and options within careers and, how long the schooling was and what kind of lifestyle you would have after, how much money, income you could make, all the things. And I was leaning toward, I kept getting pulled to chiropractic. Maybe it was because of my mentor friend in my sorority, but I was looking at all different things in the health field. I had always been very active and danced as a kid up until about 16 and cheerleading and grew up in the 80s fitness craze. And I just was drawn to chiropractic. So I went and got my first adjustment with a chiropractor that my mom knew. And I was sold. I was sold. I loved it. I love that you could help people naturally without medications, without surgery. It was just, there were so many success stories within chiropractic and I was sold. I went back to school that second semester and declared biology as my major, even though I was more of an English social studies kid. I said, all right, I'm going to do this. I'm going to buckle down. I'm going to, deal with these pre-med classes. And basically the education in college is basically a pre-med course load. So that's how I came to chiropractic. But the second part of your question, how I came to work with pregnant women and children, I was early in my career, worked for someone briefly, and then started my own practice. And thankfully, my parents helped me out with that loan, that I couldn't get on my own. And I opened a practice in New York City in Midtown. And I took on a space and big overhead. And I was like, oh, what am I going to do? So I started working really hard to build up the practice and doing a lot of networking. Friends, family came in. I used to do different events around the city. I was really, really working hard to build this up. There was no opportunity to fail. I had to make this work. And I remember working on a gentleman, Paul was his name. And as I was adjusting him, he was face down on the table. I'm doing my thing and we're chatting. And he said, do you think you could help my daughter? She's pregnant. And I thought to myself, oh my gosh, I've never treated a pregnant person. We get a wonderful education in school, but not a lot about treating pregnant women. We really get more of an obstetrics class. And then the rest of the training would be at post-grad classes. And I just immediately, as I'm saying, sink or swim, I got to build this practice. Sure, send her in. So he gave her my number and she came in and the rest is history. I did a consult with her. I looked into beforehand what to do and what not to do, things to stay away from. I think that was contraindicated. And, I just went very gently gave her very gentle treatment. And she came back in like a visit later and said, I don't know what you did, but whatever you did, my back pain's gone, my sciatica's gone. You are amazing. Chiropractic is amazing. And I was like, a light bulb went off, and I said, this is so great, and this is so cool that I could help her feel better, but also help her have a better experience during her pregnancy. And then I just was off to the races, as they say. I started taking numerous hours in continuing education, purchased different equipment to accommodate the pregnant belly, and just really, really educated myself over many months and years to really be, specialize in this area.
So now, 23 years later, you
Yes.
are one of the most well-known prenatal chiropractors in New York. So that is awesome. Congratulations.
Thank you.
To that. So just let us know, and also before I continue any further, if you are joining us live, you have any questions for Dr. Randi, please put them in the comments. I'll be sure to ask them to her. But tell us the overall benefits of prenatal chiropractic care for women.
So there's a few different components. The first is that it just helps you feel better. So, lots of different aches and pains creep in. We have, lower back pain, neck pain, and carpal tunnel syndrome, and something called pubic symphysis dysfunction, which is right in the front of the pelvis, rib pain, middle back, headaches. There's so many symptoms, so many aches and pains that creep in, and not only in the third try, which is when we usually think about them kind of creeping in, but even in the first and second trimesters. So overall, I would say feeling better would be like the number one reason why people come to see me. But other than that, we can actually prevent some of these aches and pains. So some people actually, once they learn about chiropractic, and often this is in a subsequent pregnancy, a second or third pregnancy, they will come in earlier to try to prevent what they had last time. So maybe they didn't see anybody the first pregnancy for the aches and pains. Maybe they came in toward the end and kind of suffered for a while, and then they said, oh, my friend told me I should come see you. And they say, next time I'm starting earlier. So they start earlier to prevent that pain that, again, often creeps in the third try, but can be even earlier. And lastly, one of the greatest benefits that a lot of people don't realize that they're going to receive this benefit, but we start talking about it and then they get it, is it absolutely can help with labor and pushing and baby positioning. So even if there's no pain, a lot of women come in for labor preparation.
Wow. Okay. So, okay, I know that's the importance of chiropractic care during the prenatal stage. What about when women are trying to conceive? Is chiropractic care is beneficial during that period as well, or if a woman is receiving fertility treatments?
Yes, absolutely. So I often find that sometimes when I'm working with a woman, she's just coming in preconception. She's not even, trying yet. And then as I get to know her, maybe she's coming in for a year or two. And then all of a sudden she says, you know what, we're going to try to conceive. And I say, absolutely, this is the best thing to do. In addition to some of the other things you're doing, eating healthy, maybe seeing an acupuncturist to try to conceive more easily. And chiropractic care really can tie in, because what we're doing is we're making sure that the nerves that branch out of the lower spine and go to the reproductive organs, uterus, ovaries, fallopian tubes, are functioning optimally, so that we don't want any interference or blockage in those nerves. So we can increase circulation and also, again, create better nerve flow to these organs. So many times women will come in just while they're trying to conceive naturally. And if they don't conceive naturally and they continue on to some fertility treatments, I actually sometimes will time the chiropractic adjustments right before maybe an egg retrieval or an implantation. We're very mindful of giving the body some rest after the implantation for a week or two, and then I'll have them come in after that. And we'll just, again, continue with that, creating proper nerve flow to the area and also circulation. So really can be beneficial, in addition to things like acupuncture and diet, exercise, all the different things that I know that you have a lot of those tips on your website on how to
Yeah.
conceive.
So, okay. So, how often do you suggest that a woman, either whether they're trying to conceive or if they're pregnant, how often would they come to visit with you?
That's a great question. It really varies. I take it case by case, but I will say that when someone's coming in during that period where they're having some pain, usually once a week for a period of time. So that could be a few visits, that could be for a month or two, maybe 4 to 6 weeks. So again, really varies. Once we get to about 30 weeks, I often recommend, if a woman is open to it, I'm really not pushy or pressure anybody, but my ideal scenario is if people, if their schedule allows, their finances allow, their energy level allows, I tell them to come in once a week for that labor prep, and again, to keep those aches and pains at bay. So again, it varies, but I would say once a week for 30 to 40 weeks, or 30 until their due date. And before that, kind of case by case. But, sometimes we'll go a few weeks without seeing each other. And some people will just come in when it hurts. But I don't love that schedule, because they usually come in a few weeks later and they're really in a bad way. So kind of routine care throughout. But I definitely will work with people's schedules, and everybody's so busy. So again, we take it patient by patient.
Okay. So, obviously we're in the pregnancy after 40 group. What is the average age of your patients?
I would say, not having statistics in front of me, just off the top of my head, most of the women that I treat are right around 40. I would say the kind of range is about, um, the majority of women I treat are about 35 and up, and that can go all the way up to just about 50. So because I practice in Manhattan, it really is quite common. I think, not that people in other places can't have a baby after 40, of course, but, it just is so prevalent in the area that I practice in. And a lot of women will come in and talk about the stress of that, and the terminology used, the advanced maternal age, and, you know, uh, geriatric pregnancy. And these terms make me cringe, because I really, really, I just wish that we could come up with some better terminology. But I reassure them over and over that this is just so normal where we live, and across the country, really, it's becoming just so common. So I love working with that population. Just I find that they're just such an educated population on what they want in their pregnancy, what they want in their birth. They're very discerning in their choosing their birth provider and their birth team. So it's really, really enjoyable to me to work with that population. And of course, I work with everybody. I have women, younger ages as well. But that would be, I would say 40 is probably 40, 45 is like the average.
Okay. So for me, it's, we can always give advice and tips to people, right? As to what you should do. But to me, what's really important is to actually know why we're doing things. So, I tell people, and they ask me, can you give me some fertility tips? And I'm like, my biggest thing is water, right? Drink lots of water, because it helps with, we've been told drink water since you're like 2, right? So,
Hmm.
but
Yep.
the reason you want to drink, enough water is because it actually increases your cervical fluid. So to help you with fertility. So, knowing why you're doing it is really important. So why is it that pregnant women experience back, hip, and leg pain during pregnancy?
Uh, the reason is basically threefold. So one is that immediately when we become pregnant, as most of us know, our hormone levels surge, and lots of elevated hormones. So the biggest hormone that I talk about in my practice and that impacts my patients with the work that I do is relaxin. So relaxin causes all this loosey-goosiness in the ligaments, and that can create some dysfunction. So it does come with a purpose. It is supposed to open up the pelvis, allow that baby to grow, allow us to birth our babies, allow our uterus to expand. But at the same time, it can cause a lot of dysfunction. So relaxin, number one, it happens even just in the first trimester. So people will come in and they'll say, I don't know what's going on, 12 weeks, and I'm already getting like this weird thing in my low back. Like I barely even gained any weight. I'm barely showing, and what's going on? And it's the relaxin. So number one is relaxin. Number two is weight gain, right? So as we continue through the pregnancy, average weight gain, let's say, is about 30 pounds, although it can be, really vary, of course. But let's just call it 30 pounds for our conversation today. So, it's predominantly in the belly, and it's pulling forward. And sometimes in a subsequent pregnancy, pulls downward. We get sort of this angle coming down almost to the floor in front of us. So we get a lot of pressure. Our center of gravity shifts. And then we have these postural changes. So our lower back gets that deep curve in it many times. And again, that belly pulling forward alters our posture in our upper back, middle back, our neck. So these three things, postural changes, the weight gain, and that hormonal shift of the relaxin, are the three top reasons why we would end up having some dysfunction in our spine and our pelvis.
Okay. So when women come in for treatment, do they primarily get adjustments, or do they get some other type of care when they come to visit with you?
So everyone gets adjusted. The table that I use has I use these pregnancy cushions, which have big cutouts in them, and they're really comfortable. So women love laying on their bellies because they haven't been able to lay on their belly for quite some time. So I do not only chiropractic adjustments, which are very gentle and safe and effective and absolutely modified for pregnancy. I've come a long way from treating that first patient and all the education that I've had. And a lot of what I incorporate into my treatments, because they're actually longer sessions than a lot of chiropractors can vary, 10 minutes, 15 minutes, 20 minutes, a half an hour. My visits are usually somewhere between 30 and 45 minutes. And that's not that they're better or worse, they're just different. But I add in a lot of muscle work. So I do a lot of stretching. I do a lot of getting into those little trigger points, little knots that are in the glutes and the lower back, upper back, neck, shoulders. I do some stretching and some traction on the low back, very gentle traction, and also incorporate something called spinning babies, which is a whole array of techniques and exercises to help babies to get in the right position and help with pain and help get ready for labor and pushing. So guess I kind of, there are chiropractic adjustments. We also use some special instruments and tools that help to make the adjustment very, very gentle and specific.
Okay, so now I feel totally gypped. When I saw my chiropractor when I had my son at 41, I literally went in for like 5 minutes. They were like, "Don't bother making an appointment. Just come in. We'll fit you in." And I was like, "Okay, it worked for me then." But now I'm like, "Wait a minute. I probably was getting gypped."
Just different, just different. You know what? Some chiropractors, what they'll do is they'll just really focus on the chiropractic adjustment and then they'll refer out to other people to do this other work. So I just found that I enjoy it. I've picked up so much along the way and I love it, but it's not for everybody. So I don't think you got gypped. I think you just needed to maybe reach outside the office, but I know what you're saying. It is nice. Patients do love it. They really are like, oh, I'm so relaxed when I leave. Someone who might be a new patient might be a little nervous, especially if it's their first time ever going to a chiropractor. So, they really feel relaxed and calm, and their pelvis is more open, their spine is more aligned when they leave. So there are so many benefits, but you definitely didn't get gypped. Your chiropractor did a good job, I'm sure.
Okay. Okay. We'll let you get away with that. Okay. Quick question that I have is, if a woman is close to labor or delivery and baby is breached, is there something that you can do in the chiropractic realm that can help them?
Yes, absolutely. So I specialize in a technique called the Webster Technique. And the Webster Technique is a specific chiropractic adjustment, focuses on the sacrum, which is that bone that's just below the lower back, just above the tailbone, very important for labor and pushing. And then we also work extensively on the round ligaments, which attach the uterus into the pelvis. So those can get kind of tight and pulled and stretched when we're pregnant. So absolutely. So this technique is not a breech turning technique. Many people think it is, but that is a technique that OBs do called an external cephalic version, which is a whole other conversation. But that's a technique that's done by an OB, usually in the hospital. What we're doing is just creating more space. So we can do this on a person who has a breech baby, a posterior baby, which is also called sunny side up, which can cause back labor, a baby that's transverse or kind of parallel to the floor, or even just a baby that's high. I had someone come in this week that the baby was just up a little high and she really was trying to avoid an induction, a medical induction. So she came in because the baby was not engaging, not descending. So this is a technique that creates more space in the pelvis. And what was found when this technique was created by Dr. Larry Webster, which the technique is named for, was that many babies that were in the what we'd consider a mal position, or any position other than head down, and in the correct position, many of those babies turned into the correct position. So it really was somewhat anecdotal when he was creating this technique to help with labor and help with pain. And we found that many babies do turn. So our goal is not, again, to manually turn the baby, but it's very, very gentle and effective in just letting the baby have more space, and then the baby can proceed to get in that head down position. And
That's
it's
amazing.
really gentle work. It sounds, sometimes people are like, ooh, is this going to hurt? It does not hurt. Really safe for baby, really safe for mom.
It sounds amazing though, just to be able to do that. And I know it's not for that specifically, but to know that you can do something. And it helps that you there's so many things I don't know.
Yes.
But okay. So now pregnant women we have the babies and you see women postpartum
All the time.
and also see their babies as well, newborn. So tell us how soon you can or do start seeing a woman after she has given birth.
So many women think that they need to wait for the 6 week checkup with their OB or their midwife, but you can actually come into a chiropractor right away. So after a vaginal birth, I usually will see someone anywhere from a few days after giving birth if they can get in. Sometimes it's an issue, especially in Manhattan, of getting out and in. We have bridges and tunnels and public transportation issues and all of that. And then, but if you can get to me, absolutely. So I've had women more in crisis mode. They're like, oh my gosh, I slept funny. My neck is all crunched up. Can I get in really quickly? So I went to my chiropractor 3 days after giving birth. I just needed to get checked. I wanted to make sure my pelvis was aligned from giving birth. I wanted to prevent any aches and pains from just all the sitting I was doing and my body kind of finding its way back. But normally I tell people realistically within the first 4 weeks. So just try to get in the first 4 weeks. And I'm taking into account, fatigue and feeling overwhelmed. And again, with Manhattan, you're not just getting in your car and driving. You have to figure out how logistics. Um, but definitely a wonderful thing to do, not only for aches and pains, but also just for that healing process, because we're going to start getting more active down the road. Many of the women I work with are like, when can I start exercising? I want to start exercising, and of course they have to wait until that clearance from their provider, but they want to be exercising on a really structurally sound lower back and pelvis, right? You don't want to have this misalignments and then all of a sudden you have some injury after. I just want to backtrack and say that if it's a post belly birth or C-section, I would usually tell people to wait about 3 weeks to come in, but completely safe. We use those pregnancy pillows again to be really mindful of an incision, and they also help cushion the breasts if they're tender and a woman is breastfeeding. So really, really wonderful to get in to see a chiropractor postpartum. And again, remember all the positions we're in. We're looking down all day. Our neck is just a mess. We're either nursing or bottle feeding. We're changing. We're sleep deprived. We're often nutritionally deprived. So our bodies are just in a really vulnerable state, and healing and chiropractic works wonderfully to help that process, help the healing along.
Okay. So, in as far as new moms, their babies, how soon do you see a newborn?
I can see a newborn hours, days, weeks after they're born, but really as early as, again, the parent wants to come in. I have seen babies just a few days old. And often people say, oh my gosh, why would you adjust a new baby? They don't have back pain or headaches or neck pain. So we're not addressing back pain and neck pain and headaches in a new baby. What we're doing is we're checking their spine to make sure that they are structurally, physiologically sound with regards to their nervous system. So being in utero for, let's just approximate 40 weeks can be pretty intense. Positions that the baby gets in, an arm is up overhead, their head is tilted, they're in a breech position, they're in that transverse horizontal position. They get into these really funky positions in there. So that can create some stress to some stress to the spine and cause these little misalignments. Then add on birth, whether it's a C-section or a vaginal birth, there's a lot of tugging and pulling. Sometimes forceps are used, sometimes a vacuum extraction, sometimes the shoulder is a little wedged in or the baby's not descending. There's all these different challenges, long births, long pushing phases, and even short births. Those are pretty traumatic for the baby neurologically to come kind of flying out, not to mention mom's perineum. So I always say safe and smooth, not too long, not too short. But babies, the adjustments are so gentle, safe. They're so light. It almost looks like we're not even doing anything, even though we are. And the goal is to restore normal nervous system function. And some of the conditions that parents bring babies in for, although we're not specifically treating these conditions, we're actually just restoring this nervous system function and optimizing the baby's physiological function overall. Colic, difficulty latching, constipation's a big one, gas, babies that turn their head to one side and can't feed on the other side, or they're constantly turning, that they end up with that flat head or what's called plagiocephaly. Sometimes there's crawling issues in an older child. I have a little boy that's sitting right now in that W position. He's a toddler, and the parents are bringing him in for that. So sometimes it is more orthopedic in nature, but oftentimes it's more a general wellness check and making sure baby's body's functioning optimally. It can help with sleep too, which people are always like, oh, I'm bringing my baby in. I need help with the sleep.
Yeah, I can remember when I had my older son at 41. I kid you not, whenever he like woke up from sleep or a nap, it literally took him like 10 minutes. Just like he's like stretching and making like these funny faces and going like 10 minutes before he would do anything. And it didn't occur to me like maybe like along the way down the line that it probably was because babies they're like you said, they're in funky positions, but they're like curled up, they're balled up. And I can totally see
Yes.
like after you come out, like just needing to stretch. So I didn't know if
Yeah.
that was attributed, if that could be addressed or not
Yes,
with
absolutely.
chiropractic care.
Yeah, there's something that we call unwinding, where the baby's kind of wound up and like in that kind of curled up position. And that is funny how we hold them, and we really want to hold them in that C position to kind of let them
Hmm.
sort of develop and kind of acclimate to the world. But yes, chiropractic adjustments are wonderful for a baby to get acclimated into the world, figure out, their neurology, their structure. It really is great for their bodies overall. We do so much for our babies. If you think about, like, we buy the organic sheets and we want to make sure we're breastfeeding or we're providing them with really healthy formula. All the amount of time that we spend on the stroller. I mean, in New York City, it is like your car. So you spend a lot, and even outside of New York City, right? You spend a lot of time researching all that stuff, mattress, this, that, all this, the apparatus. So it just makes sense, of course, that why would you not want your baby's spine and nervous system to be functioning optimally, right? It just fits
Yeah.
right in with a healthy wellness lifestyle that we want for our children as they grow.
So you mentioned something really quick as well, that the W position that toddlers sit in, because I remember my pediatrician bringing that up for my son, like when they kind of like to sit on their knees and their legs
Yep.
are underneath them. She said, you need to get him out of that. And I don't remember what she said. Like she didn't like give me details. She was just saying it's not good for him. It could mess up, like I guess him walking or what have you. But yeah, it didn't even occur to me again that something else that a chiropractor could address
Yes,
and help him with.
absolutely. So we work on the pelvis and the lower back for that. And oftentimes there's some structural misalignments, and sometimes there are also some exercises that we can give to help. Sometimes they've actually uh, it can actually create some problems later on with their gait and with imbalances in the pelvis and the lower spine. So we want to, bottom line is we want to correct these issues before they become bigger issues. And we sometimes see these things in older children, or we see them when we're adults. 15, a child might start getting headaches. Maybe that was something that happened during their birth. Maybe that was from a fall that they had where they hit their head really hard, but these things are never corrected. So a big part of my work is really just educating people on how important this work is, because people just don't know about it. It is definitely, over the 23 years I've been in practice, it's definitely becoming more and more common. It used to be kind of alternative to go to a chiropractor, and to take your kids to a chiropractor was kind of off the charts weird. Now it's, becoming more mainstream, but still there's a lot of education that needs to be had. So that's part of my job, is while I'm working on a pregnant woman, is really kind of educating her on the benefits of pediatric care, and right from the start. And you asked, I think in the beginning, how I became a prenatal chiropractor, but the prenatal part just kind of flows into the pediatric part. And then
Right.
that sort of flows into the family part. So people always ask me, like, do you just treat women and children? And because there's a lot of women and children in my office. And I say, no, I absolutely see the partners. And if a male partner comes in, it's usually that I've seen the woman who is during her pregnancy, or during that postpartum period. So that's usually what ends up happening is chiropractors who work with pregnant women and children often become sort of the family chiropractor, which I am happy and proud to say that I have become. So it
That's
really fits in
great.
nicely. It's very, very rewarding to treat families.
That's great. So I'm gonna ask you one more question. It's going to be in reference to the children again. So how often do you see the newborns and well, just stick with newborns. How often do you see newborns when they come in?
Um, Again, this gets back a little bit to the logistics of being in a city. It's just challenging for people to get out and about. Not impossible, of course, but I would say if a baby's coming in and I notice that there are some misalignments, some structural issues that we need to work on with the nervous system, or there's a symptom like that colic or constipation, pretty short term. I would say maybe once a week for maybe 4 weeks, 3 weeks, 6 weeks, somewhere in that range. So I'd say 3 to 6 weeks. And then maybe we'd see them for a few follow-ups. But babies respond, especially newborns, so quickly because they're, for lack of a better way of putting it, they're very malleable, right? We can get in there very gently, take some of that irritation off the nervous system, restore normal function, and usually their symptoms or their issue that they're coming in with resolves pretty quickly. And if it's a wellness visit where a baby's just coming in, parents just want to get them checked again to kind of go along with that healthy lifestyle. There's no symptom, there's no sign that anything's specifically wrong. It's usually just a couple of treatments, and then we might see them periodically for sort of wellness or tune-ups, just to check as they're going through their milestones, especially, which would be, all of a sudden they're holding their head up. Now they're starting to sit, starting to get on all fours, crawling, walking, running. So, during milestones, I often tell people to bring the baby in. And also during a crisis like an illness, we can really help boost the immune system for a baby or an older child. Ear infections respond very well to chiropractic adjustments, just helping everything flow better and move that infection out. Not to replace antibiotics, but sometimes parents will want to try some natural things in addition to medical care or just prior to medication.
Right. So now that chiropractic care is becoming a little bit more mainstream, do you find that insurance companies are covering chiropractic care, or do you have packages? How do you do your payment?
I actually personally don't participate with the insurance companies because I have found that it's really, really hard to spend the amount of time that I spend with patients and get reimbursed properly, especially with overhead in Manhattan. So that's just to be completely frank. But I do provide patients with all the paperwork that they need to bill. And many of my patients do say that they do get reimbursed from their insurance companies. So, and I will help them, if there's something they need documentation or medical records or whatnot. I always want them to get reimbursed. But I do find that they will give me feedback that many times they are able to get that covered by their insurance company. So that's really wonderful. It really varies from insurance company to insurance company. And also things like flexible spending accounts and health savings accounts are really wonderful resources if people have them. Many companies provide that service, and those funds can be utilized for something like chiropractic care.
That's definitely good to know. Okay. Well, thank you so much. Before you go, just tell everyone how they can contact you on social media, website, all that good stuff.
Okay, I keep it really simple because I haven't dove into the social media realm professionally. Of course, I'm there personally, but I do have a website. It's in the works of being revamped and updated, but the information on there is still good right now. And it's just my name. It's Dr. Randi, Randi, Jaffe, Jaffe, .com. So drrandijaffe.com. And I am happy for people to visit my website and also reach out if they have questions. And I just want to say if anyone wants to contact me and help, I can help you find a chiropractor in your area that has a specific focus of pregnancy and pediatrics. And postpartum, I would be more than happy to help. And I have a lot of resources for that.
That's awesome. Thank you so much for joining us today and giving us all that information. So yeah, I'll definitely put your information in the show notes. If you're watching this or listening to this at a later time, you can still have Dr. Jaffe's information. With that, thank you again so much for joining us, and we wish you the best of luck.
Thank you so much. Great to be here.
Take care.
Bye bye.